Hi, I'm Missy Creed, a librarian from the Library for Health Information, or the LHI. The LHI is a consumer health library located in the Ohio State Wexner Medical Center in Columbus, Ohio. The LHI provides free, reliable, easy-to-understand health resources for medical center patients, their families, and the community. Medical center clinicians can also refer patients to the LHI if patients are interested in finding more information on their own about their health diagnoses. Today, the LHI is highlighting colorectal disease. Today, we're chatting with Dr. Kalady from the Ohio State Wexner Medical Center. I will let him go ahead and introduce himself and the work he does. Dr. Kalady?
Hi, my name is Matt Kalady. I'm a colorectal surgeon here at the Ohio State Wexner Medical Center and the James Comprehensive Cancer Center. I'm the division director of the Division of Colorectal Surgery and take care of all types of different diseases or patients with disease of the colon and rectum, but have a primary focus on colorectal cancer treatment and prevention.
Let's talk about what is a colonoscopy.
Colonoscopy is an examination that allows the physician to see the inside of the colon and rectum. Basically, a flexible tube is inserted and goes through the colon, and there's a camera attached to the end of that tube, and you're able to visualize that on a video screen. And during that, you can see what the insides look like, see if there's anything abnormal. But it also allows us to take photos to document things so we can see changes over time, and allows us to actually take tissue biopsies or actually remove any kind of thing that we need to remove from the colon. There's different reasons to get colonoscopies, and I kind of break it into two broad categories. One is someone who has symptoms or has some sort of issue or problem going on that needs to be evaluated. That's called the diagnostic colonoscopy. And then the other is a screening colonoscopy, where people are completely healthy, don't have any symptoms or problems, but they go through a screen just to see if there's any preventative measures we can take to prevent colorectal cancer. For the screening colonoscopies, which we really talk about mostly here, the average age is between 45 and 50. That's a little bit of a moving target. So with no family history, no other symptoms, between 45 and 50, the standard has always been 50. And over the last year or two or a couple of years, people are now starting to trend down towards the age of 45. So I think it's best to talk about that with your physician. African Americans are a little bit distinct in that they tend to get colorectal cancer at a little earlier age, and most of the guidelines recommend age 45 is starting for pure screening colonoscopies.
Any tips for the prep that you would recommend, doctor, before somebody comes in for a colonoscopy?
I think the first thing to realize is that it's not as awful as everyone says. There's this kind of aura around colonoscopy that people don't want to do it, and the prep is terrible, and people just don't want to do it. There's always this certain negative connotation of the whole thing. But I think getting over that, and people who go through it will say it's not perfect, but it's a really, really important test. So talk to your doctor ahead of time. They will give you different preps to do. Be somewhere where you're comfortable, in your own home if you can. You'll be going to the bathroom quite a bit. And then usually the day before the colonoscopy, you stay on nothing but liquids, and then you do your prep to clear everything out. So that'll give you the best chance of having a good, adequate exam.
What are the most important things to know about colorectal cancer prevention?
I think the biggest thing is to know that colorectal cancer is preventable. We know that cancers develop over time, and it goes through a fairly routine process where you have a normal lining of the colon. You get some changes that happen. You get these little lumps or bumps or polyps, and then those polyps go through more changes and they become a cancer after that. That process takes 5 to 10 years in most situations. We know that people who get colonoscopies and get intervention that way have a decreased rate of colorectal cancer, and then also a decreased death rate from colorectal cancer, because if we do detect something, we pick it up at an earlier stage, and then we're able to treat it and intervene faster.
Can you tell me what a colorectal polyp is and what causes them?
A polyp is kind of a generic term for just abnormal growth or kind of lumps or bumps that exist within the colon. They can be any number of things. A lot of times they are just benign tissue that tends to grow a little abnormally in that one spot. They can be caused by inflammation, or they can be precancerous. Any polyp is considered abnormal, meaning that it shouldn't be there. And it's important to identify what that polyp is and take a piece of that off or remove the whole thing so we can look at it under a microscope and make a diagnosis of what that is. I would say probably the most important one of these are something called adenomas, are precancerous polyps, so they can become cancer if nothing is done and they don't intervene or remove them. The cells become a little bit abnormal. The reasons they become abnormal can be just by chance. Sometimes there are factors and things that you're exposed to in the environment, such as your diet, or smoking, or alcohol. Different things may cause changes as they go through your digestive tract and cause changes in the lining of your colon. And as those cells become abnormal, it takes time, and they have to grow and then divide and become more and more numerous. And as they become a little bit bigger, then you see these lumps or bumps or polyps.
Does genetics play a role in the person's risk for being diagnosed with colorectal cancer?
I like to say that genetics is the underlying factor to all colorectal cancer. Some of that is inherent in each individual person, meaning that you're born with a certain risk for genetics. And then some of it is just what happens, what we call sporadically or just by chance, within that particular tumor. So cancer is developed by having these genetic changes or variations or different things that happen in the cells that make the cells abnormal. We have a big complement of what we call genetic counselors. These are people who are specially trained and schooled in genetics and learning about the risk. The biggest thing that they do is they can provide a risk assessment. So people have to be referred into the genetic counselors or be recognized by their clinicians to say that they are possibly at an increased risk. And then the counselors will talk to them about what that risk means and what the implications are of potentially having a test done or having positive or negative results. So knowing that these things exist, we can intervene at a much more timely spot and hopefully prevent cancers from happening.
What kinds of colorectal cancer disparities are a concern, and what is being done to close the gap?
We still have a lot of challenges. African Americans tend to have a little bit higher incidence rate, meaning that they're per same number of population, they have a higher number of cases than other races. And then also there seems to be a little bit higher mortality or death rate of people dying from colorectal cancer in that demographic. We're still trying to figure out why that is. Some of that is inherent biology. Some of that is access to care and access to screening. We are aware of this. The James, as well as other places all around the country, are trying to make that better. That's by educating our physicians to know when to screen people, when to get them in sooner, and then making sure that we have access, or all populations have access to screening procedures. And then if something is detected, that they get great multidisciplinary high-level care like we offer at the James.
Thank you for joining us today to talk about colorectal disease. To learn more about the Library for Health Information, please visit our website at go.osu.edu/HSL-LHI. See you next time.